Come on, green belts. It's time for some chops and some lifts. Let's do this.
First thing we're going to do is scapular movement. Get in a nice neutral spine, have the arms locked, and push the shoulder blades away from each other, and then bring them closer to the spine. Do it in a nice controlled fashion. If you want it harder, do it in a push-up position. Then if you want to add a little bit extra resistance, get a nice thick band, put it around your hands, put it around the thoracic spine, lock out those arms, nice neutral position, and separate the shoulders and allow them to come together. Nice controlled movement. There again, if you want to add a little bit of extra resistance, come to a push-up position, but do not allow the lower back to arch. Next is a rowing type scapular movement. Just allow the band or a cable crossover machine straight out in front of you, and all you're going to do is pull it directly back to the spine, one arm at a time. Allow the shoulder blade to come straight back and squeeze to the spine. Try not to elevate the shoulder blade at this time. Next is the dip. Squeeze the shoulder blades back, open up the shoulders, allow the butt to come down, and then push your body weight up to the ceiling. Control this movement nice and slow. Do not allow the shoulder to go forward. Squeeze those shoulder blades together and do a nice controlled movement. Next is a lat pull down type position. You can do one arm at a time. Allow it to just pull that shoulder blade down and back, hold for a second, and allow it to relax. You can do two arms if you want. Or you can hang from a pull-up bar. Squeeze those shoulder blades down and back in a nice controlled fashion. This is a Parloff press. You bring the band to your chest, shoulders down and back, neutral spine, and just extend your arms out straight. All you're trying to do is this is an anti-rotational movement. Do not let it rotate you. And we're not doing rotation. We're just trying to stop rotation. Nice controlled, bring it to your chest, and then extend your elbows out. Take a nice deep breath and see if your core can actually hold it with you breathing. And this is your lift position. You're going to get in a lunge position. The down leg is going to be closer to the band. All you do is bring it to your chest and push it away. Nice and controlled. This is your core stabilizers working with rotation with diagonal movement patterns. Control yourself. This is going to add a little bit extra rotation. You're going to push and rotate as you're going through the upward phase and the downward phase. Try not to rotate the hips and legs when you're doing it. This is a chop position. The downward leg is going to be on the opposite side of the band where it attaches. Same thing, pull your chest and push down to the other hip. This is the extra rotational movement for the thoracic spine. Pair it with breathing. Breathe in when you open up. Breathe out when you collapse down. This is working your P and F patterns. We will talk more about that later. For the extra movement, what you're going to do is open up the chest and then allow it to rotate down toward the other hip. Nice and controlled. Do 10 to 15 reps each side. This right here is your push-up. This is stuff that we're going to talk about to not do. You want your back to be nice and stable. Try not to snake up when you're doing your push-up so you have enough upper body strength but your core is not stable. Tuck that chin, engage that core. Do not allow it to arch back. Here's a nice stable push-up movement. If you're having trouble doing the push-up either on your knees or on your toes, just get a chair or something to elevate you. Keep that core nice and engaged and work on trying to stabilize your pelvis with upper body pushing movements. Next, we're going to work on spinal flexion. If you have a hard time touching your toes or you feel like part of your back is not wanting to move right, put a band around your feet, and this is going to allow you to sit up but do a spinal curve at the same time. We want one vertebrae at a time. So lower it down one vertebrae at a time. Let your shoulders go, head relax. Then tuck your chin, allow your upper body to move, and then your lower body.